So as soon as he gets to the baseline, boom, it's time for another breath from the machine. So the patient barely gets all that gas out before it's time for another breath. And then in C, we can see where for some reason, the expiratory time has been shortened. So the patient gets a mandatory breath in, he exhales about halfway, and then another breath is given. He exhales about halfway of that, and another breath is given. And you can see where that baseline level has been increasing and increasing, and that's our auto PEEP.
Thanks, Shauna. Always good for nurses to learn how to read those scalars. I can't tell you how much it helps to know that. The next alarm we're going to talk about is inverse IE ratio alarm. So what would cause an inverse IE ratio alarm? Well, anything that would cause a change in the respiratory rate in your patients. If your patient's in pain, if you're moving your patient, if you're doing a procedure on your patient, if somebody's in the room who's agitating them or talking to them, anything that's going to make their respiratory rate change, maybe make them breathe a little bit faster. A normal IE ratio is 1 to 2, 1 to 3, 1 to 4. An inverse ratio would be 2 to 1, where you're inhaling more than you're exhaling. So that's where the alarm would go off. So when do you want to see an inverse IE ratio? When you want to keep the lungs inflated and allow for re-recruitment of the lungs. Otherwise, we don't normally do that. So now would you think, what would I do? Again, the first thing you want to do is check your patient first. Do you want to have that inverse IE ratio? You just have to activate that function on the alarm system of the ventilator, and then it won't be alarming off anymore. And your respiratory therapist can help you. Is your respiratory rate too high? Were you trying to blow off some CO2 earlier in the patient, and now you don't want to do that anymore, and you're over-ventilating your patient? Simply just need to decrease your respiratory rate on the patient to help with that. Is the ventilator being used in volume? Title is